तो अच्छा अपन कौन से ज्यादा समझने वाले हैं?
हाँ ठीक है। चलो, सेकंड चीज क्या है, इंक्रीज इन ट्रांसवर्स डायमीटर ऑफ द क्रेम, सो दिस इज द क्रेनियम। तो इसका ये जो ट्रांसवर्स डायमीटर है ना वो बढ़ गया होगा बिकॉज
तो
ऑफ
कौन सा बात है?
इम्प्रॉपर डेवलपमेंट है। और द थर्ड वन दैट इज फंटनल्स। यू सी क्या होता है आफ्टर सर्टेन एज ना, ये जो फंटनल्स है ना वो कंप्लीटली बंद हो जाते हैं। उसको हम सूचर्स, सूचर वहां पर प्रॉपर इंटैक्ट हो जाते हैं, ठीक है। पर this is a condition that is called the cleidocranial dystosis, where you will find absence of clavicle, increase in transverse diameter of cranium, and third that is a retardation in frontal ossification. ठीक है, we move further. You see, there is another one condition called the rickets, which occurs because of vitamin D deficiency. एंड यू सी, ये जो 3 months to 3 years दैट इज वेरी वाइटल एज फॉर द रिकेट्स। अगर उस टाइम पर डेफिशिएंसी रहेगी विटामिन डी की, इट विल लीड टू अ कंडीशन कॉल्ड एज अ रिकेट्स। अगेन इट्स अ बोन डिसऑर्डर, ठीक है। Lastly, you see type of spina bifida. These are there is this again developmental disorder that is called as spina bifida. ठीक है, अगर यहाँ पर वर्टिब्रास के अंदर प्रॉपर फ्यूजन नहीं हुआ तो क्या रहेगा, यहाँ पर हर्निएशन हो जाएगा, मतलब कि फ्यूजन प्रॉपर नहीं हुआ है। तो उसकी वजह से तो कंडीशन होगी दैट इज कॉल्ड स्पाइना बाइफिडा। अगर स्पाइना बाइफिडा के अंदर अगर फ्यूजन नहीं हुआ है और उसके अंदर से मेनिंजिस लीक हो रहे हैं तो उसको हम क्या बोलेंगे, मेनिंगोसील, ठीक है। और अगर यहाँ पर जो यहाँ पर हर्निएशन है उसके अंदर मेनिंजिस के साथ अगर स्पाइनल कॉर्ड भी जा रहा है तो डेट इज कॉल्ड एज अ माइलो मेनिंगोसील, ठीक है। तो सी स्पाइना बाइफिडा ऑक्लूटा, राइट, उसके अंदर इतने सिम्टम्स नहीं रहेंगे, माइल्ड पेन ही रहेगा। पर मेनिंगोसिल के अंदर क्या रहेगा, देयर इज अ यहाँ पर मेनिंजिस भी जा रहे हैं और यहाँ पर क्या है, मेनिंजिस अलोंग विथ स्पाइनल कॉर्ड, एवरीथिंग इज गोइंग इनटू दैट हर्निएशन, ठीक है। तो दीज ऑल आर बिकॉज ऑफ डेवलपमेंटल डिसऑर्डर, ठीक है। सो विल क्विकली आई विल आस्क यू टू, ओके, बोन मैरो बायोप्सी यूजुअली कहाँ से बोन मैरो की बायोप्सी करता है, एक तो मेनुब्रम स्टर्नम, ठीक है, और दूसरा है इलियाक क्रेस्ट। सो ऑलवेज रिमेंबर इलियाक क्रेस्ट एंड द मेनुब्रम स्टर्नाई are very important site to collect bone marrow biopsy, right? Those who have joined for MCQ session, wait for 5 minutes. This our regular class is going. We'll quickly start with the MCQ session. Huh? Okay. For our regular class students, na, these are the MCQ you need to solve. Identify the incorrect sentences quickly. Law of ossification says that secondary center which appears first fuses last. Fusion starts from the age of 25 years between the bone. Epiphyseal plate remains present up to the certain age. Once fusion takes place, there is no longer present. And lastly, periosteum is
सर
the inner bone.
पैलेस्टीना मीन्स आउटर मोस्ट बोन ना? आउटर नहीं, सोचर बोलना।
So identify the incorrect. कौन से इनकरेक्ट है? ऐसा जरूरी नहीं है कि एक ही होगा, ज्यादा भी हो सकते हैं एक से।
फोर्थ इनकरेक्ट है सर।
फोर्थ इज इनकरेक्ट, राइट। फोर्थ के अलावा
सेकंड
दिस इज आउटर
second is
सेकंड
also incorrect. You see, fusion starts at puberty and it
एंड
ends at 25
यस।
years. Now you need to identify the correct sentence. Epiphysis is the portion of bone which develop from secondary center. Metaphysis
राइट।
is a diaphysic end of epiphysis.
यस, सेकंड इज राइट
Okay.
एंड
Presence
दिस इज
of
नॉट
greater and
रिटर्न।
lesser trochanter around femur because of tension epiphysis. And lastly,
राइट।
please requesting everyone
ऑल आर
other
करेक्ट
than the student to go on mute. Activities like jumping, helping in development of articular ends of the bone.
ऑल आर करेक्ट
यस,
All
फोर्थ इज
are
आल्सो
correct.
राइट।
ऑल आर
Every you
करेक्ट।
see,
यस सर।
all four sentences are the right. Okay. Rickets occur because of which deficiency?
विटामिन डी।
विटामिन डी
Vitamin
विटामिन डी।
विटामिन डी।
D. Okay. Cleidocranial dystosis is a clinical anatomy related to which bone?
क्लेविकल।
क्लेविकल क्लेविकल
Clavicle.
क्लाविकल, absence of clavicle।
In between the vertebrae, there is a presence of which cartilage? If you remember, there are three types of cartilage.
Hyaline cartilage membrane.
Hyaline five.
Membrano
That's
cartilage.
elastic.
Mem
No.
membrano.
You see, there were three
Mem
types of cartilage, hyaline,
Hey,
present
bone.
between long bones. Between vertebral
Fibro.
column,
membrane
there was a fibrocartilage.
The three thing elastic is the ear.
नहीं. Hyaline cartilage,
Fibrocartilage.
तो
membranous
ये
Fibrocartilage.
fibrocartilage.
फाइब्रो ही तो मैं बोल रही थी ना सर. हाइलिन इज
Okay.
द लॉन्ग बोन में था.
Identify the
और
correct
इलास्टिक इज
sentence.
द ईयर.
Spongy bone is present at the end. सही है. Compact
Aphysis is
several
right.
compact
Compact
bone
bone is
present.
quite distant.
All are
Right.
correct. All are correct.
Yes, sir. All correct.
All are correct. Okay. Common site to collect bone marrow?
Iliac
सभी
crest and manubrium style.
Manubrium is turning.
So option B, na?
Iliac.
Iliac crest and manubrium
B.
sternum. Okay. So for everyone, thank you for your patience. Now we'll quickly join for the MCQ session, right? Okay. Are you able to see my screen?
No, sir.
No,
Okay.
sir.
Just a minute. Okay. So we are at this stage of Homeoda, right? And you see, we provide lectures. These lectures are at the weekly basis, right? So requesting everyone to join it to get fully prepared for your competitive exams, right? Okay. Now you see, we'll move with the MCQs. Okay. So one by one, I will show one MCQ and you need to answer, right? So the first MCQ is this. I expect everyone to answer it in the
Sartorius.
chat box, please. Okay.
Oh,
Rather
Sartorius.
than speaking, better you answer it on a chat box. So,
Okay,
which is
sir.
the longest muscle of human body? Okay. So the longest muscle of the human body, that is okay. Everyone is saying D, sartorius, correct. The longest muscle of the body is sartorius, right? We move further. Identify the correct number for their cranial nerve.
सभी ऑप्शन बी.
Okay.
B. Because of Vegas is 10. B का 1. And O. A is 4. उत्ता
Okay.
फैगस ओ ए का सर थर्ड होगा. तो बी.
So see, let's try to solve this. You see, we have one diagram. You can take a screenshot of this. You see, number 1, that is olfactory. Number 5, that is trigeminal. Number 7, that is facial. And number 10, that is vagus nerve, right? You see, these cranial nerves are frequently asked in exam. So request everyone to take a screenshot of this, no? Okay. So you see, the correct answer is option B. Olfactory, that is number 1. Vagus, that is number 10.
10.
Trigeminal, that is number 5. And facial, that is number 7, right? We move for the next MCQ. Which nerve supplies the diaphragm?
Phrenic nerve.
Phaneric nerve.
Phrenic nerve.
Phrenic nerve, right? Okay, correct. You see, this is the diaphragm. What is diaphragm? Diaphragm is a structure which separates abdomen with the thorax, right? And you see, this is the diaphragm and it is supplied by left and the right phrenic nerve. So the correct answer is phrenic nerve, right? We move further. The normal number of vertebrae in cervical region is
7.
7.
7, right? So you can take a screenshot of these two, right? You see number of vertebrae, that is cervical 7, thoracic 12. We have 5 lumbar, right? 5 sacral vertebrae which are fused in one, and lastly we have 4 bones which are fused to form the coccyx, right? So these are the vertebrae with their numbers. Okay. So C7, T12, L5. We remember like this. Okay. Injury to radial nerve.
Let's drop.
Wrist drop.
Wrist drop. Sir, wrist drop.
Wrist drop. Wrist drop.
Wrist drop. Sure. Okay. You see, radial nerve injury leads to a condition called as a wrist drop, right? Okay. Okay. You try to answer this. Damage to facial
D.
nerve in Bell's palsy results in
Deviation of mouth to affected site.
D. Deviation of mouth to affected.
Deviation of mouth to affected site.
deviation of mouth to affected side. Are you sure,
Yes,
everyone?
B.
Yes.
Inability to.
Bell palsy. Yes, sir.
Okay. You see, are you sure? Right? You see, now you see this diagram. You see in Bell's palsy, right? What happens? You see, this is slightly twisted question. There is a, you see, there is a drooping of eyelid that was already present in the this inability to close eyes, right? But you see over
सर
here,
4 पूरे हो गए ना फिर
sorry,
भी हो गए फिर इसका मतलब राइट
sorry.
सर इसका
मतलब लॉस
करेक्ट
ऑफ
आंसर
स्मेल
क्या
है
है?
वो भी है इनेबिलिटी टू क्लोज आईज ये भी दिया है
नहीं पता चला. Okay. So you see, correct answer is that only deviation of the mouth to the affected side, right? Now we see this. The epiphysis of a long bone develops from those who are in regular classes would be able to answer this.
So secondary
Epiphysis,
ossification center.
Secondary ossification center.
secondary
सर बी
ossification.
सेकेंडरी ऑल्सो
You see, this is a structure of a long bone, right? In the center, we have a diaphysis which develops from the primary center, right? And at the end, we have epiphysis which develops from the secondary center. Over here, the question asked that is the epiphysis of a long bone develops from, so answer is secondary center, right? Okay. Primary centers are those centers which are present or which appears before at the uterine intrauterine life, while the secondary center appears after birth, right? Okay. Now try to answer this. Mesencephalon is another name of
Hindbrain. Midbrain.
okay.
मिड होना चाहिए आई थिंक मिड ब्रेन
C okay.
तो सिर्फ क्योंकि सर फोर फोर ब्रेन को शायद शायद प्रोशिफ्लॉन ऐसा समथिंग बोलते हैं
Okay, okay. Correct. You see, mesencephalon is another name of midbrain, right? So option C is correct. You see, this is the midbrain. This portion that is called as the midbrain, and that is also called as this mesencephalon. If you know, diencephalon means anyone? Diencephalon is
सर
another
हैंड
name
ब्रेन
of forebrain.
हैंड ब्रेन सर
Forebrain.
ओके
Diencephalon is another name of forebrain. Mesencephalon is another name of midbrain, right? We move further. You see, try to
सर
consider
हैंड
this
ब्रेन
sentence.
का फिर क्या नाम होगा एक्सक्यूज मी सर हैंड ब्रेन का फिर बताइए
Sorry,
सर हैंड ब्रेन का अदर अनदर नेम ऑफ हैंड ब्रेन
another another name of hindbrain. नहीं नहीं नहीं, mesencephalon that is midbrain. Forebrain का होता है diencephalon. ठीक है?
हैंड ब्रेन इज ओनली हैंड ब्रेन
Yes. Okay. Now focus on this MCQ. Now consider this following sentence. Lesser curvature is the common site for gastric ulcer. Gastric canal receives most of the insult from the irritating drinks.
I think option B.
सर स्टेटमेंट सर स्टेटमेंट ए तो सही है और
B.
बी
बी
Both
होगा सर।
statements correct, but not related to each other.
Okay,
Not related to each other.
not related to each other. Okay, correct. Okay, let's try to solve this now. There are two curvatures in stomach. This one that is called as a lesser curvature, and this one that is a greater curvature. Right now, what happens now? Whenever something goes into the stomach, right, from this cardiac opening, right, oh, what happens now? The first structure that is exposed, that is of a lesser curvature. ठीक है, तो हम जो भी पीते हैं, बीट कोल्ड ड्रिंक्स और बीट एनी इरिटेटिंग ड्रिंक, राइट, the first structure that will be coming in contact with, that is a gastric, that is a lesser curvature. ठीक है, and you see that is the reason why lesser curvature has more tendency to develop the gastric ulcer. So gastric ulcer is a commonly present at the lesser curvature, right? So you see in this lesser curvature is a common site for gastric ulcer because gastric canal receives most of the insults from the irritating ring. So you see what is that both statements are correct and B statement gives the correct explanation for the A statement. So over here option A is correct and not the B. They both are related to each other, absolutely related. Are you getting concept? Concept पता चला कि जैसे ही वो कैनाल में
Yes, sir.
आएगा ना, the first structure that is exposed, that is of a lesser curvature, है ना? We move further, right? Which muscle is called as a whistling muscle?
Buccinator.
बुसिनेटर।
वैक्सीनेटर यस सर हाइंड ब्रेन इज अनदर नेम ऑफ रोबन
Okay, okay, okay. Okay, let's focus on this now. Which muscle is
रोबन
called a whistling
सेफलॉन
muscle?
सर यस
Buccinator.
वैक्सीनेटर इज राइट
Buccinator, right? So you see over here, you can see the muscle in green color. That is our buccinator, and we also call it as a whistling muscle, right? So buccinator, that is the correct answer. It is the whistling muscle. Okay. We move further. Okay. Lying down position with the face directed upward is called
सुपाइन पोजीशन।
lying down position with
सुपाइन
the
ए।
face directed upward is called. So when a person lies on
सुपाइन पोजीशन।
face directed upward, we called it as a, there are few positions, right? Supine position, prone position, and lithotomy, right? You see, when a person is lying, when the face is directed upward, we called it as a supine position. When a person lies on the abdomen and face is lying facing towards the floor, then we called it as a
प्रोन
prone
प्रोनेशन
position.
प्रोन पोजीशन।
Okay, okay. We move further. Now we try to solve this.
बी ऑप्शन।
Okay.
B option.
Mr. Gupta is saying B. Okay. Dr. Archana is saying B.
Option B.
D option. Option D.
Option D.
Option D.
सर ऑप्शन
Yes.
डी ऑप्शन डी
Yes, sir. Option.
Okay. A. Okay, okay. You see, we'll try to solve this now. You see, loss of touch we called as a anesthesia, right? So you see, loss of touch sensibility, that is anesthesia. So one, that is C. Then loss of pain, that is analgesia. So loss of pain, so 2B, right? So 1C, 2B. Then loss of temperature sensibility, that is thermanthesia, right? So you see, loss of temperature, so 3A, right? And lastly, exaggerated sensibility, it is hyperesthesia, right? So that is so option B is correct. 1C, 2B, 3A, 4D, right? You go through the chapter of clinic, first chapter, Introduction to General Anatomy, and there are various terms related to clinical anatomy, right? Believe me, that are very high yielding portion for the MCQ to score, right? So from that now you will get the correct answer. These all terminologies are mentioned over there, right? Okay. If you will join our class, if you will join our paid class for anatomy, now everyone, I am telling to everyone, you will get such kind of more information, right? Okay. We move further. Okay. Which of the following is not a content of carotid sheet? This is slightly tricky.
Internal.
Common carotid
Internal
artery.
artery.
Internal system. Yes, common carotid artery.
Do answer it in a chat box. Chalo, I want to see who is getting right this MCQ particularly. Okay, Mr. Gupta, Mrs. Chaudhary saying A. Okay, Dr. Richa saying B. Okay. So which of the following again is not a content of carotid sheet, right? Let's try to solve this. We'll first try to see the contents of the carotid sheet. You see, this is the carotid sheet. It contains internal jugular vein. It contains a vagus nerve. It contains common carotid artery. You see, common carotid artery goes upward and then it divides into internal carotid artery and external carotid artery. Out of this, mark my words, you see, internal carotid artery is a content of carotid sheet, but carotid sheet does not envelopes external carotid artery. आर यू गेटिंग दिस? सो ये तीनों स्ट्रक्चर है ना, इंटरनल जुगुलर वेन, वेगस
Screen
नर्व,
है.
common carotid artery and as well as internal carotid artery, everything is
Sir
present
is
within the carotid sheet, but over
स्क्रीन
here
जो
sir.
सर है ना वो सही नहीं है एक्चुअली. निमोनिक्स ऊपर के जो है वो कट गए हैं और साइड्स के नाम भी
ये
कटे हैं.
न्यूमोनिक्स, अब
तो
न्यूमोनिक्स आने
स्क्रीन
दीजिए,
से
अब ट्राई टू अंडरस्टैंड द कॉन्सेप्ट
नहीं
ना.
सर. सर वो ठीक है सर, बट ये कटा हुआ है ना सर साइड के.
सॉरी.
स्क्रीन छोटा साइड का सर
Screen
सर
कटा
cutting.
हुआ
स्क्रीन
है
क्लियर
जो.
नहीं है वो.
क्लियर
स्क्रीन
नहीं.
स्क्रीन क्लियर नहीं है इसीलिए. जी जी.
ओके ओके ओके. आपको डायग्राम दिख रहा है?
सर
Yes,
डायग्राम
sir.
दिख रहा है, लिखा
यस
हुआ नहीं
सर.
दिख रहा है.
हाँ हाँ,
ओके,
लिखा हुआ नहीं दिख रहा, डायग्राम तो क्लियर है. यस.
जस्ट अ मिनट.
वो दिख रहा है सही.
ओके 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 ओके. So, okay, the normal adult heart weight is approximately
250 से
130.
300 ग्राम.
okay. So the correct
250
answer
से
is
300 ग्राम.
250 to 300 gram.
Okay.
Okay, okay. We move further. The outermost layer of the meninges is
ड्यूरामीटर.
यूरोमेट्रिक.
okay. चलो.
Diameter.
ड्यूरा.
Answer it in chat box na. The outermost layer. Sunil ji saying C, that is durameter. Okay, Preeti saying A. Okay. Chaudhary ji is saying C. Okay. So we'll see. You see, this is the diagram. You see the the outermost, that is among these three, na, that is durameter. In the middle there is a arachnoid matter, and the innermost, that is a pia matter. Right. So for this, na, correct answer is durameter. Right. We move further. You see, to try to solve this.
एंडो एंडो न्यूरियम किधर होगा?
Sorry.
सर एंडोन्यूरियम मतलब ऑप्शन डी वो कहाँ पे?
पता नहीं चला आपका क्वेश्चन?
सर ये ऑप्शन डी एंडोन्यूरियम वो क्या होता है?
एंडोन्यूरम है ना, इज अ डेलिकेट लेयर ऑफ कनेक्टिव टिश्यू। ठीक है, तो वो तो क्या है कि इंडिविजुअल नर्व फाइबर जो एक्सॉन रहता है ना, वहां पर प्रेजेंट होता है, पर ये तो सिर्फ नाम डाला है, वो वहां पर एग्जैक्टली मैंने इसका कवरिंग नहीं है, दैट इज अ कवरिंग ऑफ दिस नर्व फाइबर्स, राइट? ओके, नाउ वी ट्राई टू सॉल्व दिस।
ए।
A option.
ओके
Sir, yes, both assertion reason is right and correct explanation.
ओके, सो अर्चना जी सेइंग ए। ओके, you see, we'll try to solve this. Okay. So the median nerve. So the median nerve are the chief nerve which supplies the thenar muscle passing through the carpal tunnel. ठीक है. Now you see what happens if there is this compression. Na, this leads to the weakness and wasting of the thenar eminence, leading to a syndrome very famously known as a carpal tunnel syndrome. So in this now option A is correct, right? You see, carpal tunnel syndrome causes weakness of thenar muscle because the median nerve passes through the carpal tunnel, right? So, option A is correct. Okay. Now try to solve this.
Mhm.
A option.
सी, ऑप्शन सी।
A option किसने बताया? Okay, Dr. Om is saying option A. अच्छा, वो तो previous में. ठीक है. Anyone else wants to try?
Sir, एक चीज में क्लियर कर दीजिए, 1 to 8 इज अ सेंसरी ना.
Sorry?
No, neuralgia is a mixed nerve.
128 जो होती है सर,
Yes.
मतलब 1 to 8 जो है वो सेंसरी होती है ना.
Okay.
ट्राई
Three
ट्राई समझ
options.
तो फिफ्थ,
Three option.
तो इसका मतलब 9 10 जो होगा
Fifth,
वो मिक्स
fifth,
होगा.
fifth nerve is mixed nerve.
अच्छा,
हम्म,
okay.
So I think A is right
no.
option.
Okay, okay. You see, we'll try to solve this, na? You see. Trigeminal neuralgia. You see, believe me, trigeminal neuralgia is one of the most painful condition. Na? 2 week back, I saw a
Yes.
patient who has severe pain of left-sided trigeminal neuralgia. So there is a severe pain. It's a very painful condition. That is because of this trigeminal nerve, right? But you see, in trigeminal is mainly sensory and not the motor, right? So the second sentence over here, that is false, right? So option A, that is A is true and R is false. Clear?
False. Yes, sir.
So
Yes.
option A is correct, right? Okay. Now try
सर
to solve
ट्राई
this.
सेवन किस नंबर पे आएगी फिर?
Sorry?
हेलो. ट्राई
Sorry?
सेवन किस नंबर पे सर आई है? सर ट्राई सेवन का नंबर क्या है, क्योंकि 108 इज अ प्योर सेंसरी.
Five,
Fifth,
five, five,
एक सौ
fifth
अट्ठाईस
number.
five, five,
Five
fifth
and
number.
five.
फाइव.
पहले
Five
तो
number
आया था
is
वन
एमसीक्यू,
mixed
टू
तो
nerve,
एट
आपने
no,
उसका
sir?
स्क्रीनशॉट नहीं लिया था क्या? है ना? चलो, ओके, नाउ ट्राई टू सॉल्व दिस. Anyone? Anyone wants to try this?
सर बी ऑप्शन।
Sorry?
Oh, sorry, C answer.
Okay, you mentioned
Sir,
it in the
C.
chat box.
Option
I
number
really
6.
want to see who is getting this MCQ correct. So you mentioned your answer in chat box. Okay. सपना जी सिंह सी, डॉक्टर हिमानी बी, दीप्ति सिंह सिंह बी। ओके। ओके। ओके, चलो, anyone else wants to try? Okay, so now we'll try to solve this na. You see, so this MCQ is asked from the contents of the middle ear. We have three portions of the ear: external ear, middle ear, and inner ear, right? So this is the MCQ asked from the contents of the middle ear, right? So you see over here na, this wall, that is the superior wall, will called as a tegmen tympani, and it is associated with medial cranial fossa. So the tegmental wall is associated with middle cranial fossa. So for one, the correct option is C. So one के सामने आएगा C. ठीक है. Then the second is carotid wall. So now we try to see over here carotid wall. The other name of the carotid wall, as you see, an internal carotid artery is located over here. This wall is called as the anterior wall, right? और anterior wall से एक मसल रिलेट करता है, that is a tensor tympani muscle. So for two, that is carotid wall, there should be opening of tensor tympani muscle. So 1 में आएगा C, 2 में A, right? So 1C, 2A. We solve it further. Mastoid wall. So mastoid wall means the posterior wall of the middle ear, also called as a mastoid wall. ठीक है. तो mastoid wall के अंदर एक एमिनेंस आता है, that is called as a pyramid. So for mastoid wall na, option D. So 3 is D, right? So 1C, 2A, 3D, and now lastly 4, labyrinth wall. Labyrinth wall means the middle wall. It contains a very large impression in the middle, we call as a promontory. So medial wall of the middle ear contains a large impression, we call as a promontory. So 1C, 2A, 3D, 4B. Okay. So Dipti ji as well as Dr. Himani was correct, right? Option B is correct. Okay. We move further. The joint between atlas and axis is example of which joint?
Pivot joint.
Okay. Those who have joined our paid classes for anatomy, right? This session was done previously. Those who are willing to join ना, आपको इसका recording भी मिलेगा, right? So the joint between atlas and axis, that is of a pivot joint, right? So option B is correct. You see the joint, that is it gives you only rotational movement. So that is of a pivot joint. The largest nerve in the body?
Sciatic nerve.
Sciatic nerve.
Dr. Himani says sciatic nerve, correct. Right? So you see the largest nerve of the body supplying अच्छा चलो मैं ऐसा पूछता हूँ कि sciatic nerve supplies which compartment muscle of thigh? तो बताइए. Is it
Anterior.
anterior, posterior, medial or lateral? Anyone?
Posterior.
Okay, you see, the longest nerve of the body, na, that is sciatic nerve, supplies most of the muscle from the posterior compartment. Anterior compartment of thigh has femoral nerve. Medial compartment has obturator nerve. And lastly, the posterior compartment has sciatic nerve. Okay. Which cartilage is
And the
present in
lateral compartment.
intervertebral disc? No,
Lateral
lateral, no.
compartment.
Muscles of thigh are divided into three portions, three compartments: anterior, posterior, and medial.
Posterior and
Lateral,
middle.
there is no compartment.
Okay, sir.
Okay. Which cartilage is present in intervertebral disc?
Fibrocartilage.
चलो, जिन लोगों ने अभी सेशन
Fibrocartilage.
अटेंड किया है, हाँ, आप क्यों बंद हो गए? तो आंसर इज सी, दैट इज फाइब्रोकार्टिलेज. ओके, दिस
सर
इज द
फाइब्रो
लास्ट
का
वन.
टेम्पो मैंडिबुलर भी था ना सर?
हाँ हाँ,
दो
टेम्पो
एग्जाम्पल
मैंडिबुलर
थे
भी आएगा. हाँ, ठीक है, चलो.
प्लीज.
दिस लास्ट एमसीक्यू ऑफ द डे. चलो मैं ये देखता हूँ ये किसका करेक्ट जाता है. Tarion fracture is dangerous because it may cause
सब एराकनॉइड हेमरेज।
Okay, subarachnoid. Very good. और किसी को कुछ
देखिए
ट्राई
आपने
करना है?
बोला था ना एराकनॉइड, और उसके बाद मतलब वो सबसे डीपर है।
ओके, चलो किसी को और ट्राई करना है कुछ? Okay, Samsung is saying A, subdural hematoma. Okay, let's try
सर
to
बी,
solve it.
एक्स्ट्रा ड्यूरल। सर बी होगा।
Extradural.
एक्स्ट्रा।
Okay,
यस सर।
okay, okay. Let's try to solve this. Now, what is terion first? You see, in the brain box there is one point where there is a meeting of three suture. You can see this suture, again you can see this suture as well as this suture. So there is one meeting point of three sutures, and this point is called as a terion, right? What is the problem? It is the thinnest part of the bone. Deep to it there is a middle meningeal artery. A fracture एट दिस साइड कैन टीयर दिस आर्टरी. अगर टेरियन का फ्रैक्चर हुआ तो मिडल मैनिंजल आर्टरी का रप्चर होगा, राइट? एंड सो द ब्लड गेट्स कलेक्टेड बिटवीन स्कल एंड ड्यूरा मैटर, फॉर्मिंग एन एक्स्ट्रा ड्यूरल hematoma, right? So the correct answer for this, it is a extra dural hematoma, right? So fracture of the terion ruptures the middle meningeal artery, and because of this there is be chances of extra dural hematoma, right? So this is regarding this point, that is terion. Always remember, terion is a junction for three sutures, and the site. You see, we are asked to wear helmet because helmet, when we wear helmet now, this terion gets extra protection.
उसमें फिलहाल वो घर आला डाया में बिस्तर पे जाके मैं तलवा
Please,
जाऊँ।
I request everyone to be
कोई
on a
बोल
mute.
रहा है।
Please, okay, okay. सो हम हेलमेट क्यों पहनते हैं? क्योंकि टेरियन जो पोर्शन है, इट गेट्स एक्स्ट्रा, दैट इज अ साइट विच नीड्स एक्स्ट्रा प्रोटेक्शन, राइट? सो in order to save our terion we wear helmets. Okay, so these, that's all from our today's MCQ session, right? Okay, I request everyone.
एक
सर वन क्वेश्चन, वन
हाँ,
क्वेश्चन।
जस्ट एक फाइनल एमसीक्यू
सर
आ रहा
क्यों
है
सी।
चैट बॉक्स में, एक एमसीक्यू, प्लीज सॉल्व।
अच्छा, please try to solve the MCQ in the chat box.
आंसर बताएं।
B.